Hi everyone, welcome to Femina Bridal Show. My name is Sukriti. I'm assistant beauty editor at Femina, and today I have with me my favorite once again. We are chatting with Dr. Jaishree Sharad. She's a celebrity cosmetic dermatologist. Welcome, Dr. Sharad. Thank you so much
Thank you
for
so
joining
much
us.
for having me here. Thank you.
How have you been? How's it going? I know you started working long before, so it doesn't make any sense for me to ask you how's it going after the things have opened up. I know you've been already in clinic taking patients for a very long time already, right?
Yeah, absolutely. I think we started in May last year. So, although it was slow, but now things have really picked up and
Great job.
life is good.
Okay, so to start with, tell us something that the wedding season is here. Let's just talk about the treatments, the procedures that brides can take. But before we start with all that, I want to ask you, is it absolutely necessary for every bride to consult a dermat at least once?
I think yes. You are
Okay.
asking the wrong person because I will
I know
I will always say yes. And please, not just the bride, but the groom as well.
Yes.
You
Yes.
hopefully only get married once. That's at least the thought when you're getting married. So please consult with a dermatologist at least once.
Right.
So
Yeah.
just as people do jewelry and clothes and hair and makeup and everything, I think it's very important to have clear skin as well.
All right. So now that you've, pretty much very clearly and no diplomatic answer there that we should do it, how well in advance should the couple start doing it?
Right. So now you're learning. Couple.
The couple.
Yes, I think an ideal period would be 3 months, right? If people have time and if their weddings have been planned well in advance, then I think 3 months is ideal. Having said that, if you do not have problem skin, if you have very clear skin and you just want a little glow on that big day, then you can even start 6 weeks in advance.
Okay. So coming to my next question, and an important one, especially in this scenario when because of the COVID, because of the lockdown, because of restrictions, there were too many changes in the date. There were people who were just getting married in like months time or something like that. If that's the situation, say for example, we do not have time in hand and it's just 4 months or say 6 weeks before the wedding, can the treatment, and this I'm saying if the person has a little bit of problematic skin and a concern to target, so can those treatments be customized to the couple's need and the availability of time?
Absolutely. So you know what the thing is that all our treatments are bespoke. That's the beauty. We're not a chain of clinics. We are, like, I'm an individual with my clinic. So every person who walks in, the skin is examined, it's evaluated, and the treatment is customized.
Right.
So, even if you come to me like a week in advance and say, listen, I'm getting married in a week, I will still do my best to make sure whatever I can, to the best of my capacity, we can do for you. So yes, even if you have problem skin, if you have acne, for example, of course you will be, you will have to be ready to take the tablets that we give you, to apply the lotions that we give you, to be ready to probably do some treatments, maybe some peel or some cryotherapy, or sometimes if you have cystic acne, we give you some injections. So you have to be ready for all that. And if you are game, then we will make sure that your skin looks absolutely stunning on your big day.
Okay. Having said that, do you then also suggest that if someone is coming to you, say just a week in advance, so I'm sure then obviously not everything can be handled just in a week. I'm sure you'll try your best to do it to perfection, to at least have a wedding ready skin, if I can say that. But what do you think then? Do you suggest them for follow-up sessions post the event is done?
Oh, yes. So if somebody has acne or hyperpigmentation, or by and large, these are the two common reasons why the problem skin that people end up coming to us with. It's not going to go in like a week's time. Whatever we do is going to be temporary, just to make sure your skin looks, healthy, on your wedding day. But that doesn't mean your acne would stop, So post that, again, your acne will keep coming. So it is a process, and we need to identify if you have any polycystic ovarian disease, if you have hypothyroidism, insulin resistance, or is it just acne because of stress, or is it acne due to cosmetics or products? And these days people are using tons and tons of products on their skin, and that clogs your pores. So you need to identify why are you developing the acne, and then treat the acne. And it takes about 4 to 6 months for the entire thing to clear up. So yes, we do whatever we do for that 1 week. We'll pump you with whatever tablets, this, that, but that's not the right way to actually go ahead. So post your wedding, you'll have to do a proper treatment.
All right. Okay. So again, my favorite question now. What are the absolute hit services that according to you the brides can try, the grooms can also try?
So very recently I had put up something on my Instagram. It's one of our signature medifacials that we do. It's about a 1 hour treatment where we do a microdermabrasion. So, the dead skin is exfoliated, the grime, the dirt is removed, the pores are unclogged. Then we apply a fruit mask, which is like basically 5 fruits, pineapple, papaya, mango, passion fruit. So all these, the extract of that in a bottle, right? So we apply that on your face for about 5-10 minutes, and then take about 10 minutes, and then rinse it off, and we follow it up with an oxygen jet peel and a skin brightening mask. Now, this is a very safe procedure, and it gives you an instant glow. So that's like a complete hit, and it's not expensive. So that's something that not just the brides and grooms, but their relatives, their siblings, their parents, everybody opts for.
Right.
Then the other treatments that, if the person has a slightly, if the person comes 3 months in advance, then of course we do assess the skin. And then we would, if there's hyperpigmentation, we would do Q-switch ND-YAG laser toning, and we'd also do some peels, and if the skin is dull, dehydrated, then we do microneedling.
Okay.
We do PRP, where we take your blood, we centrifuge it, take out your own growth factors and inject them into your skin to make it look really radiant. So these are some of the treatments. Laser hair removal, of course, you should start well in advance, but a lot of that fluff, when it goes off, the skin looks very clear. Can I also add some of the bespoke high-end treatments here? So people who can afford, and when you're spending so much on your jewelry and your clothes and this, that, destination weddings or whatever, you can also opt for skin booster injections. A lot of brides are doing that nowadays.
Right.
So these are tiny bits of hyaluronic acid injected into the entire skin. And this basically will help in building collagen, and more than that, it helps to sort of slightly plump the skin and hydrate the skin. So when light falls on the skin, it reflects, and the skin really glows. It really glows. So of course, it takes a month for the result to show. So you must do it a month in advance. These are skin booster injections. Then we have a lot of grooms and brides come for under eye fillers. Because the eyes are sunken and they look tired. So however much makeup you apply, they're not dark circles. When you stretch the skin, you see there's no pigmentation. There's nothing dark. The shadow goes away. So we put in a little bit of hyaluronic acid filler there to sort of just make the skin look more even, and that hollowness. You don't look tired all the time. So I guess these are, starting from something as inexpensive as $3,500 to something which, if we're talking of boosters, then it's about 30K. So everything is there,
Is there.
And it just depends on what, of course, you have to consult with a dermatologist, because then you can't just walk in and say, oh, let me do a peel or let me do a booster. Your skin may not be ready for it.
Right.
So, I mean, not everybody who comes and says, do my under eye filler, I'll do. Or not everybody who says, I want a lip filler, I'm going to say, oh yeah, come, I'll do. No. If I think you need it, will I do it?
Yes, of course. Right. Okay. So you just mentioned about fillers, and these just for knowledge, I want to ask, these fillers can also be taken if in case you just want like bright skin, healthy plump skin. That's it. There's no target there's no concern to target. You just need like a healthy looking skin.
So no, so that's what I said. So when you need a healthy looking skin, it's better to opt for skin boosters and not for fillers, right?
Okay.
So we normally, for brides, I do not encourage fillers for the face and stuff. I would probably say, okay, if you have very thin lips, you can enhance the lips a little. It really looks nice. Or you can do your under eye fillers. But other than that, I would say, you'd rather opt for skin booster injections. They're like injecting moisturizers into your skin. They're not fillers.
Okay.
Yeah.
All right. Got it. Dr. Jaishree, we have spoken about this a number of times, and it's not just for brides or grooms. It's for, I think, everyone who walks in a dermat's clinic. It's about this, still this anxiety and this whole, finding it little weird that, oh, we are going for these treatments. Oh, these might not be safe. Oh, our skin do not need it. My skin doesn't need it. So do you think that apprehension is still there? Do you think people are still scared to try? Whereas, you've been vocal about how safe these procedures are, how safe these treatments are because of the innovation, because of the technological advancement, and you've been talking about it. But do you still think that people are somewhere scared to try?
People are, yes. Things are changing, trends are changing. A lot of people are now open to doing medifacials in a clinic rather than going to a salon. Now, I'll give you a very simple, algorithm there. We are qualified doctors. We have done our MBBS, first of all, right? Post our 5.5 years of MBBS after our 12th standard, we have done our post-graduation in dermatology for 3 years. So that's 8.5 years straight off. Then there are people like me who have done fellowships in cosmetic dermatology for 1 year. So that's 9.5 years of study after your 12th standard. And then it doesn't end there, because every year I go abroad every year to upgrade myself. So I'll spend about a month, even today. It's my 21st year of practice, but I will still go and learn. Of course, in the pandemic, we haven't, but we've had tons of, virtual webinars and conferences. So you have to constantly upgrade yourself. So that's the kind of knowledge we are talking about. Now, you are absolutely okay by walking into a salon down the street where you don't even know the qualification of that person, and that person will do anything to your skin, and that you're okay with.
Yes.
But you're not okay with going to a qualified hardcore dermatologist's clinic who understands your skin that well and do something. I do not understand this funda. I do not understand this psyche. Why? So this has to change. It is changing. I'm not saying don't go to parlors. Please go. I have nothing against them. But what I'm trying to say is that, why the apprehension? Why do you feel that, oh, skin doctors will only give you steroids? No, they don't. I don't. So I think it's time people understood and valued what we do, and our qualification and the amount of effort that we put in. And please, yes, as you rightly said, technology is advanced. There's a lot of research that goes behind everything. Things are US FDA approved, rather than just buying a derma roller or a gua sha or a peel just because you've seen somebody on social media use it and say, oh, it's great, and then trying it on yourself and ending up with side effects. You might as well just, spend one visit to, a little money on that consultation for a dermatologist, spend a little time, and you get things right.
Yeah, right. Okay, last question. What do's and don'ts you suggest for the brides? Right.
Yeah, I think it's very important, guys, first of all, to focus on what you're eating. Okay, whether it is 3 months or 3 days, stop having sugar, stop having dairy, stop having fried food, junk food, food with high glycemic index. Now, it's going to benefit you in 2 ways. Number one, your skin is going to glow. Okay, your acne, if you have acne, that will subside. You won't break out. Number two, anyway, you're going to lose weight if you eat this kind of healthy food.
Yeah,
right. So please start eating well. Please Make sure you hydrate yourself well. So you drink about 3.5 liters of water. That's very important. Now, this is the time when you are going to be running around and, your trials, and then your rehearsals, your dance, this, that, everything, or meeting people, looking for your cards, invites, whatever, decoration. I mean, of course, you have event managers, but you still have that personal, you have to go and you have to do a lot of stuff. So make sure you always use a sunscreen whenever you're running around. So do not forget to use your sunscreen. Carry it in your purse, keep it in your car, whatever it is, but you must use your sunscreen. And you must take your power naps. So if you're not getting adequate sleep, if you can't sleep for 7 to 8 hours at night, during the day, try and take your 20-minute power naps to just relax a little. That's very important. Do not forget your under eye serums at night, because you don't want really dark circles on your big day. Of course, concealers are there, but it's always better to have nice, clear skin. And do not try anything, in your last 2 weeks or last week or whatever, not even a skin treatment, So I always tell people that whatever you do, try it at least 2 weeks in advance. Even if you've had a side effect, we have time to rectify it.
Yeah, your skin will heal. Yes.
Your skin will heal. So don't try anything last moment, even if it's a hair color or, sometimes you may develop an allergy to a hair color. Then it could be any kind of treatment, or it could be a home remedy. This is the time you should not be doing home remedies on your own. So it's very important. Catch on your sleep. Do a little bit of exercise, of course, that goes without saying. Focus on your diet. Don't forget to cleanse your face at night, however tired you are. Remove your makeup, and just apply, at least if you can't layer your skin with your serum and night cream and this, that, the other, at least use one under eye serum and one moisturizer on your face at night and sunscreen in the morning. I think this much you must do. And, trust your dermatologist and go ahead with whatever, treatments he or she tells you. And I think stay happy. It's very important. You're going to be getting married. So it's a once in a lifetime thing. And whatever's happening inside, it shows on the outside. So if you're apprehensive, if you're worried, if you're, upset or whatever it is, whatever you do, it is going to come on your face. You spend thousands of rupees on your skin treatment, you will still not glow. So please be happy, because that's really important. We don't just say it for the heck of it, because it's a play of hormones at the end of the day.
Right. Absolutely. Right. So, okay. Thank you on that note. Thank you, Dr. Jaishree, for having this chat. It's always nice chatting with you and nice catching up with you. So thank you. Take care.
Thank you so much. Thank you. All of you, please take care. Bye-bye.
Thanks. Bye.